Hi, everybody, and welcome to our live Google Hangout on Air. I'm Sunny Galt, and this is a special Hangout on Air with the New Mommy Media Network and Pregnancy Magazine. So thanks so much for being with us today. We are talking about what does labor actually feel like? A lot of you that are maybe pregnant with your first baby may be wondering, okay, now I know I have to have this baby. What is it actually going to feel like? And joining us today as our expert is Dr. Diana Ramos. She is an OBGYN. She's also the co-chair of the National Preconception Health and Healthcare Initiative. So, Dr. Ramos, thanks so much for being a part of our Hangout today.
Thanks, Sunny, for having me.
All right, so what would you describe labor as feeling like? I'm sure you have patients come to you, again, first-time baby probably, and going, I have no idea what to expect. So what do you tell your patients?
So I think, first of all, it's really important to realize that pain is personal. And what may be painful for one person may be completely non-painful for somebody else. So don't compare yourself and say, well, she said there's no pain, or she says there's a lot of pain. Pain is personal, and know your body. So with that being said, knowing your body, then some analogies that have been given is that it feels like really bad menstrual cramps. But some women say, well, I've never had any menstrual cramps, so what do you do? Right? Well, you're going to find out, right, when you have a baby. But, it's along that spectrum. So some women describe it as very severe menstrual cramps. Others describe it as severe rectal pressure, as punching pain. It really is quite variable, and it really depends upon the person, upon the size of the baby, as well as the position of the baby as the baby's coming down. So it's variable. I wish I could tell you exactly this is how it feels like, but it really varies.
And does it also depend, too, on how many babies you've had? Have you found that, patients that come back to you for babies 2, 3, whatever, does, maybe their perception of the pain may even change? Maybe they've had childbirth education classes or whatever that help them deal a little bit better with it. I feel like there's a lot of factors that could go into how we describe pain and how intense we think it is. Yeah.
Right. So some of those factors do play a role, but unfortunately, many times every pregnancy is completely different. So I wish I could tell you the more babies you're going to have, the less pain, or the pain's going to feel different. That actually is not the case. It really is quite variable. Sometimes the baby could be coming up what we call OP, or sunny side up, and that's more painful, and it's a difficult labor to have. Whereas maybe the first time the baby was coming face down, head down, no problem. So it really is quite variable from pregnancy to pregnancy.
Okay. And let's talk about the progression of pain, because we know when the contractions start, we may not even really know what's going on. We may not even describe it as pain in the beginning, right? So can you take us through what someone might be able to expect as far as the progression of pain or pressure is concerned?
So again, it depends, but generally, and I oftentimes remind patients that it's okay to come into labor and delivery 2 times, 4 times with the first baby, because they don't know what to feel. And so they start to feel some cramping, and they think, okay, this is it, I've got to go in. And we'll check them, and they're just maybe a centimeter dilated. So it's important to realize that the pain will progress and will in all likelihood get worse. But there's sometimes when the woman is coming in at 8 centimeters, which is almost completely dilated, and she's barely feeling any pain. So it really is quite variable depending upon your own pain threshold. So I wish I could give you a better answer and more definitive, but there really isn't a definitive one.
I remember I have 4 kids now, and during my first baby shower, I remember a relative of mine said, "Oh, I didn't even know I was in labor until I had to push." And I'm like, "Are you kidding me?" I'm like, "That's the kind of labor I want to have." Now mine did not go that way, and I had contractions that were very, very short, even from my very first contraction that I had all the way through pushing the babies out. And I can tell you that I knew that I was definitely in labor, and I knew, that it was painful, but I don't have a very high pain tolerance. So how do you ease your patients' minds when it comes to pain, and people that might just be really concerned about that going into labor and delivery?
So this is a really important conversation to have before you go on to labor and delivery, to have with your OB provider and talk about what are you going to do for pain. Are you going to want to try and do it without any medication, and maybe try what we call now the hypnobirth or just breathing? Or are you going to want to try maybe a narcotic or maybe an epidural? But all of these things are things that women should research and learn about before they get to labor and delivery, and not the minute of arrival and they're in pain thinking, okay, what am I going to do now if I don't even know what my options are? So, I oftentimes have the conversation with those patients who've never had any of that with their OB provider. These are the options, and there is no perfect pain medication for everybody, and you can always move from one pain medication to another pain medication. The good thing is that there are options, and we can find ways to help her feel more comfortable and help it be a happy situation and not so stressful and painful.
Right. All right. Well, Dr. Ramos, thanks so much for being with us today. It was great having you on our Hangout. And
Thank
of
you so much.
course, yes, and we want to thank everyone for being part of our Hangout today. Don't forget to visit our websites, newmommymedia.com as well as pregnancy-magazine.com. We have apps. We've got some great articles and great podcasts that deal specifically with some of the topics that we are talking about today. So be sure to check us out, and we'll see you next time on the next Hangout.